Nanapod na ira. Ay, sa mukha, eh. Good morning, Earthlings! It's a new day, and it's a fun day of learning. Good morning, Hazelnatics and Gwen Nation! Alam nyo guys, excited talaga ako ngayon. Kasi, me and my autocadas will have our first ever road trip! And, since may nag-comment na fan, sabi niya kung pwede ba daw ako gumawa ng vlog about chronic rhinosinusitis with nasal polyposis. Well, it's a challenge accepted. What are you waiting for? Let's go! So as of now, we're going to our destination. Parang busy sila, di ba?
Mark, gini siya.
We're going to Labi! Chronic rhinosinusitis with nasal polyposis is a subgroup of chronic rhinosinusitis that is characterized by the presence of
Flash swellings that develop in the lining of the nose and the paranasal sinuses, lasting for more than 12 weeks and commonly caused by bacteria or fungi.
Let's find out what are the clinical manifestations of this disease.
So it manifests subtly and it starts with an upper respiratory tract infection. The patient can also present with a chronic inflammation of the lining of the nose as well as anterior and posterior rhinorrhea.
It may also manifest a hyposmia lasting for more than 12 weeks and also presence of nasal congestion and discharges, you know that? Ew.
So there you have it, guys. Those are the clinical manifestations of chronic rhinosinusitis with nasal polyposis. Can you tell me and tell all the viewers what are the different kinds of diagnostic tests for us to diagnose chronic rhinosinusitis with nasal polyposis?
Of course. So actually there are 5 tests for your chronic rhinosinusitis with nasal polyposis. First is your nasal endoscopy. Second is your imaging studies such as your MRI and CT scan. Next, you can opt to have your nasal cultures. And then fourth is your skin allergy test. And the fifth is a test for cystic fibrosis.
Oh, so these tests are so expensive, right?
Yes, you can use my code MarkVisionKapunong22 for you to get any discount to any pharmacy.
I need you, and I miss you, and now I wonder if I could.
Okay, nagtabok me. Nasukol na ang driver. Kay Dugay kay me.
Hello!
Hi! Nakasarado.
It's locked!
So guys, here are the treatment options for chronic rhinosinusitis with nasal polyposis.
Initial interventions are oral glucocorticoids and antibiotics. Surgery for glucocorticoid failure. Maintenance therapy including intranasal glucocorticoids and leukotrienes. Biologic agents for refractory diseases. Aspirin desensitization therapy.
Patients with chronic rhinosinusitis with nasal polyposis increase the risk of chronic periodontitis, and patients with nasal polyposis also have bone destruction with ophthalmic sequelae and neurologic sequelae.
What's my prognosis?
Chronic rhinosinusitis, it has its own persistent in nature, so it will eventually become significant morbidity in life. So it will cause reduction in the quality of life. It will also cause reduction as well in the productivity of that affected person. It is also associated with exacerbation of the asthma and even serious complications such as meningitis. It's very necessary with early and aggressive treatment because it still has a satisfactory outcome.
Oh, yun! See the beauty in me. Huwag niyong kalimutan na abangan ang next video ko. Tanaw na lang yun mo aning nga video. Please lang!
Like and share!
Click the bell button! Until my next vlog!
Chronic rhinosinusitis with nasal polyposis. Correct?
Chronic rhinosinusitis with nasal polyposis. Chronic rhinosinusitis with polyposis.
Chronic rhinosinusitis with nasal polyposis. Chronic rhinosinusitis with nasal.
The next day.
Chronic rhinosinusitis. Chronic rhinosinusitis.
Chronic rhinosinusitis with nasal polyposis 5 times.
Chronic rhinosinusitis with nasal polyposis. Again.
Chronic rhinosinusitis with nasal polyposis. Chronic rhinosinusitis. Joke lang!
Rhinosinusitis.
Polyposis. Lagi ko kaumot.
Rhinosinusitis.